Health authorities in Argentina are currently grappling with what is being described as the nation's most severe hantavirus season in over a decade. Since the start of the 2025-2026 epidemiological cycle, the Ministry of Health has confirmed 101 cases of hantavirus infection, a sharp increase from the 57 cases recorded during the same period in the previous year. This surge has been accompanied by a notably high case fatality rate, which currently stands at over 31%, claiming 32 lives so far. While hantavirus is a known endemic threat in the southern cone, the current volume of cases has pushed the country above the epidemic threshold for the majority of the season. Public health officials and ecologists point to a massive rodent boom, often referred to locally as a ratada, as the primary driver of this escalation. This phenomenon is frequently triggered by specific ecological shifts, such as the synchronized flowering of certain bamboo species or unusual weather patterns that lead to an explosion in food availability for wild rodents. In this instance, experts attribute the rodent population spike to a cycle of historic drought followed by intense rainfall, which facilitated rapid seed dispersal across rural and semi-rural landscapes. As the rodent population density increases, so does the risk of spillover into human populations. +3. While hantavirus has historically been associated with the remote forests of Patagonia in the south, recent surveillance data reveals a significant geographic shift in the disease's burden. Approximately 60 to 80% of confirmed infections are now occurring in the central region, including the provinces of Buenos Aires, Entre Rios, and Santa Fe. This movement into more densely populated areas has raised the stakes for public health reporting and surveillance. The disease primarily presents as hantavirus pulmonary syndrome, or HPS, a severe respiratory illness. Transmission to humans typically occurs through the inhalation of aerosols, microscopic droplets in the air, contaminated with the saliva, urine, or excreta of infected rodents, most notably the long-tailed pygmy rice rat. In Argentina, the circulating strains include Hantavirus andescens and Hantavirus mamorense. The situation has recently gained international attention following a confirmed outbreak aboard the international cruise ship MV Hondius, which departed from the port of Ushuaia. This incident has triggered global contact tracing efforts and put international health agencies on high alert, as the cruise ship context presents unique challenges for containment compared to the isolated rural settings where the virus usually resides. The core of the current public health crisis centers on the unique biological characteristics of the Andes virus strain, or ANV, which is the dominant variant in the southern Argentine outbreaks. Unlike most other hantaviruses found globally, the Andes strain is documented to be capable of limited human-to-human transmission. This characteristic was tragically illustrated by the 2018 to 2019 outbreak in Epuyén, and it remains a central concern for the current cluster linked to the MV Hondius cruise ship. As of mid-May 2026, the World Health Organization and the European Center for Disease Prevention and Control have identified 11 cases associated with the ship, including 3 deaths. Laboratory testing confirmed the presence of the Andes virus in these patients, and the working hypothesis suggests that while the initial infection likely occurred on land in Argentina, subsequent spread may have happened through close contact between passengers in the confined environment of the vessel. This international dimension has sparked a diplomatic and logistical firestorm. The Argentine government, which formally withdrew from the WHO in March 2026, has accused the organization of politicizing the outbreak to influence sovereign health decisions. This friction comes at a critical time, as the country's health budget has faced a 30% cut, potentially impacting the speed of epidemiological surveillance and the capacity of regional labs to process diagnostic tests. +3 in domestic clinics and hospitals, the medical reality is stark. Hantavirus infections often begin with nonspecific symptoms such as fever, muscle aches, and fatigue, which can easily be mistaken for common influenza or other seasonal illnesses. However, the progression to the cardiopulmonary phase can be rapid and devastating, characterized by a sudden onset of shortness of breath and fluid accumulation in the lungs. Because there are no specific antiviral treatments or licensed vaccines for hantavirus, clinical management relies entirely on early supportive care. This includes the use of mechanical ventilation and, in some severe cases, extracorporeal membrane oxygenation, or ECMO, to support heart and lung function. The high mortality rate seen in the 2026 season, particularly among men aged 20 to 49, underscores the severity of the cardiopulmonary syndrome. Health ministries in provinces like Salta and Chubut are reporting clusters of cases within families, reinforcing the need for strict isolation protocols for those suspected of carrying the Andes strain. Surveillance teams are currently tracing the footsteps of infected individuals through the forested hillsides of Patagonia and the agricultural hubs of central Argentina, attempting to pin down the exact environments where exposure occurred and whether ordinary social interactions are contributing to the spread. Prevention and public guidance remain the most effective tools in mitigating the impact of the hantavirus surge, as officials emphasize that the risk to the general public outside of known endemic areas remains extremely low. Public health agencies are currently focused on educating residents and travelers on how to minimize contact with rodent reservoirs. This includes practical measures such as sealing holes in homes, using traps to manage rodent populations near dwellings, and ensuring that food and waste are stored in rodent-proof containers. For those entering enclosed spaces that may have been infested, such as sheds, barns, or cabins, the standard advice is to ventilate the area for at least 30 minutes and then use a disinfectant, such as a bleach solution, to wet down surfaces before cleaning. This prevents the virus-laden dust from becoming airborne and inhaled. In clinical settings, healthcare workers are advised to use high-level personal protective equipment, including N95 masks and eye protection, when treating suspected cases of Andes hantavirus to prevent nosocomial transmission. +3. The long-term outlook for hantavirus management in the region is increasingly tied to understanding ecological and climate-driven variability. New modeling suggests that as climate change reshapes weather patterns, the distribution of virus-carrying rodents may continue to shift into new frontiers, exposing populations that have no prior experience with the disease. The transition from historic drought to intense rainfall creates a boom and bust cycle for vegetation, which in turn dictates the rodent population density. While the current outbreak has put health authorities on high alert, experts stress that hantavirus does not possess the same pandemic potential as highly transmissible respiratory viruses like the flu, as it still requires very close and prolonged contact for human-to-human spread. However, the limits of current medical knowledge are clear. Without a vaccine, the focus must remain on robust surveillance, early detection, and the protection of vulnerable rural and outdoor workers. As the 2025-2026 season continues, international cooperation in pathogen sharing and genomic sequencing will be vital to tracking the evolution of the Andes strain. Stay informed on public health developments by subscribing to our updates on global health reporting. The epidemiological investigation into the current hantavirus surge has shifted significantly toward international transit hubs, following the confirmation of a cluster among passengers and crew on the expedition vessel MV Hondius. The vessel, which had been conducting tours of the Antarctic Peninsula after departing from the port of Ushuaia, became the center of a multinational health alert when several individuals presented with severe respiratory distress. According to reports from maritime health authorities, the initial patient, a crew member, was medevaced to a facility in Punta Arenas, Chile, where molecular testing identified the presence of the Andes orthohantavirus. This specific strain is uniquely concerning to global health agencies due to its documented capacity for person-to-person transmission, a trait not shared by the North American Sin Menombre strains. The World Health Organization's regional office has since tracked contact chains extending from the ship to 5 different countries, marking the first time a hantavirus outbreak of this scale has been linked to the international cruise industry. This has led to the implementation of stringent red zone protocols at major Argentine ports, where incoming and outgoing vessels are now subject to mandatory rodent inspections and cargo fumigation. particularly for shipments originating from the high-risk central and southern provinces. In the laboratory sector, the burden of diagnostic confirmation has fallen heavily on the Malbrán Institute in Buenos Aires, the nation's premier reference center for infectious diseases. Technicians at the institute are working to sequence viral samples to determine if the current surge involves a new sublineage with increased environmental stability. However, the surge in demand for testing has coincided with severe logistical constraints. Reports from internal health ministry briefings indicate that a 30% reduction in the national health budget has led to a shortage of high-sensitivity PCR reagents and specialized laboratory consumables. This has resulted in a diagnostic backlog, with some rural clinics in provinces like Chubut and Rio Negro waiting up to 10 days for definitive results. In the absence of rapid testing, clinicians are forced to rely on presumptive positive statuses based on white blood cell counts and the presence of immunoblasts in peripheral blood smears, a hallmark of hantavirus infection. This delay in confirmation is critical, as early intervention in an intensive care unit is the only factor proven to reduce the mortality rate of the pulmonary syndrome. The tension between local health directives and international oversight has reached a focal point regarding the pandemic, labels appearing in some media outlets. While the rodent explosion has increased the frequency of spillover events, virologists from the National Council for Scientific and Technical Research emphasize that the virus's fundamental biology remains unchanged. Unlike influenza, hantaviruses do not stay viable for long periods in the open air and typically require the high viral load environment of a rodent nest or very close physical contact to spread. Nevertheless, the scale of the current rodent population, estimated in some regions to be 10 times the seasonal average, has created an unprecedented environmental load of viral particles. Public health officials are monitoring the shipping and agricultural sectors with particular scrutiny. There are concerns that grain shipments from the Pampas region could inadvertently transport infected rodents or contaminated nesting material to international markets. In response, the National Service for Agri-Food Health and Quality has issued updated guidelines for the storage of agricultural products, requiring all silos and shipping containers to undergo rigorous rodent-proofing and disinfection prior to export. Meanwhile, in the affected hospitals, the clinical reality for frontline workers is one of high-stakes triage. The Andes virus variant requires isolation protocols similar to those used for viral hemorrhagic fevers, placing a significant strain on nursing staff and personal protective equipment supplies. In the city of Bariloche, a primary hub for both tourism and regional healthcare, intensive care units have reached 85% capacity, primarily occupied by previously healthy individuals who contracted the virus during outdoor work or recreational activities. The Argentine Ministry of Health has faced criticism from regional governors for what they describe as a centralized and slow response to the supply chain needs of these remote facilities. While officials maintain that the national strategic stockpile of ventilators and ECMO circuits is sufficient, the logistical challenge of transporting this equipment across the vast distances of Patagonia remains a significant hurdle. These developments underscore the complexity of managing a zoonotic disease that is as much a product of ecological shifts as it is a challenge for modern medical infrastructure. Public health strategies currently being deployed across the Southern Cone emphasize a proactive, multidisciplinary approach to surveillance known as One Health, which integrates veterinary, environmental, and human medical data to predict future outbreaks. Central to this strategy is the systematic monitoring of rodent populations, specifically the long-tailed pygmy rice rat, or Oligorhizomys longicaudatus, by tracking the availability of food sources, such as the seeds of the colehu bamboo or the mast crops resulting from unusual rainfall patterns. Biologists can provide local health departments with early warning signs months before a spillover event occurs. When rodent densities exceed specific thresholds, authorities trigger community-wide alerts. This level of environmental surveillance is critical because, as researchers note, once a human case is identified, the environmental viral load is often already at its peak. The The current crisis in Argentina has highlighted the need for international cooperation in these ecological studies, as the migration of rodent reservoirs does not respect national borders, necessitating a shared data network between health agencies in Argentina, Chile, Uruguay, and Brazil, for individuals residing in or traveling to affected regions. Public health guidance remains focused on breaking the chain of transmission between rodents and humans. The most critical practical takeaway is the prevention of aerosolization. Health officials strictly advise against dry sweeping or vacuuming areas where rodent activity is suspected, as these actions propel virus-laden particles into the air where they can be easily inhaled. Instead, the recommended protocol is to first ventilate the space by opening windows and doors for at least 30 minutes. Following ventilation, surfaces should be thoroughly saturated with a disinfectant solution, typically a mixture of 1 part household bleach to 9 parts water. This wet cleaning method ensures that any viral material is neutralized and remains weighted down during removal. Furthermore, residents are encouraged to maintain a buffer zone around dwellings by keeping grass short, removing wood piles or debris from near the home's foundation, and sealing any openings larger than a 1/4 inch with steel wool or caulk to prevent rodent entry. For those engaged in high-risk activities such as cleaning long-abandoned outbuildings or working in agricultural storage, the use of a well-fitted N95 respirator and gloves is considered an essential safety standard. The ethical challenges of reporting on hantavirus involve a delicate balance between maintaining public vigilance and preventing unnecessary panic that could damage local economies or stigmatize affected communities. Because the Andes virus strain carries the unique risk of human-to-human transmission, the ethical responsibility of health officials extends to ensuring that isolation protocols are managed with both rigor and compassion. This includes providing clear communication to the families of the infected and ensuring that healthcare workers have the necessary support to manage high-risk patients without fear for their own safety. There remains a significant limit to current medical knowledge. Despite decades of study, the scientific community still lacks a definitive reason why some individuals develop the fatal pulmonary syndrome, while others experience milder symptoms. The absence of a vaccine or specific antiviral treatment remains a major gap in the global health infrastructure. Until these medical milestones are achieved, the primary defense against hantavirus remains rooted in traditional public health pillars: education, environmental management, and early clinical suspicion. This report is based on the latest available data from health ministries and peer-reviewed virological studies. For ongoing coverage of international public health developments and emerging epidemiological trends, consider subscribing to our updates.